Early pictures interesting. They were supplied by Major Tom Haviland, who I'm going to introduce now. Tom, thank you for very much for coming on this video.
John, thanks for having me on the show to talk about this very important topic.
Now, Tom, as the name would imply, has been a major in the United States Air Force for a career. Also an engineer, mathematician, and data scientist and analyst. So in a good position to do this work. Now, what on earth are we looking at here, Tom, please?
We're looking at white fibrous clots that have been supplied by embalmers, and they're seeing these all around the world. Embalmers are seeing these clots, and they're seeing them actually in a high percentage of their corpses, unfortunately, John. And they've been seeing mostly over the last 3 years. I actually have a small vial of the clots that I can show the audience live. I'll turn it slowly around so people can see the consistency of them.
Yeah, you can see that really clearly. And what are they, and where did you get them, Tom?
Got these from embalmer Richard Hirschman, who was featured in the Died Suddenly movie. Richard's been sending vials of these out to laboratories and scientists all over the world who are trying to examine the clots and figure out what they're made of. One of the theories is that they're made from amyloid protein. Amyloid is A-M-Y-L-O-I-D. It's just a fancy term for a misshaped or misfolded protein that builds up in our bodies. So,
and there's some fibrin from blood clotting processes in them as well, is there?
Correct. Dr. Ryan Cole has looked at them, the famous pathologist from Idaho, and he says it's a combination of the amyloid protein, fibrin. You know, our blood has fibrinogen in it that is in liquid form that then converts into fibrin when there's damage done to the lining of the veins or arteries, and that fibrin is white. And then there's also, he's found platelets in there too, and they're colorless. So that combination of fibrin, platelets, in this amyloid or amyloid-like material.
And what's the consistency like? Is it? Can you pull it apart? Is it rubbery? What does it feel like?
It's rubbery. It stretches. It's rubbery. It can break if you put enough force on it, but it's almost like a rubber band. You know, it looks like a calamari and kind of feels like a rubber band to the embalmers. Very unusual.
Now, these have been, in the embalming process, these are flushed out of the circulatory system, and they're collected by embalmers. So these have been taken directly from the circulatory system of the recently deceased. This is where these come from.
Correct. Embalmers have two favorite injection site points when they do embalming. Their favorite is the carotid artery in the neck. So that's the main spot they've been finding these clots. They also will do an injection site point sometimes in the iliac artery down in the pelvis region that then runs down to your femoral arteries in the legs. So that doesn't necessarily mean where the clots are being formed, John, but that's where the embalmers seem to be finding the clots, obviously, as they're flushing out at these injection site points. However, some of the embalmers have told me recently they've had to actually create more injection site points because when they run into a body that has a lot of these clots, then they have to use alternate points in order to get them all out. And it's actually lengthened the process of embalming. Embalming used to take about an hour to hour and a half for an embalmer, and now it's taking about 2 to 2.5 hours for an embalming.
So in some of the recently deceased, this is actually clogging up their circulatory system, such as the embalmer can't flush the blood out.
Yeah, and the embalmers that I've talked to are pretty insistent that they believe the clots are forming before death. They think that they may be forming after death as well, but they're insistent that they are forming before death because they're seeing them in bodies that are only an hour or two old and still warm. They have not been refrigerated. And there's no way, they said, these clots could have formed in the hour or two since the person was deceased.
That means, Tom, that these clots are almost certainly the cause of death.
Yes, I think it's you get this in your system, it's quite obvious it can cause strokes and heart attacks, right? A piece, breaks off and forms an embolism, for example, you can get a stroke. And one of the interesting things, John, is the traditional clots, like the grape jelly clots and the chicken fat clots that embalmers have been seeing forever.
Yeah,
they almost exclusively appear on the venous side of the body, but these white fibrous clots are appearing as well on the arterial side, on both the venous and the arterial side, which it's very uncommon for embalmers to see clots on the arterial side.
I mean, there's no question that if these were these things in arteries were just occlude the arteries, and of course you'd have a heart attack, of course you'd have a stroke. And the other thing I'm noticing, Tom, is if we look here, this has kind of got a branching structure. I think this is what you call a cast.
Yes.
It is essentially a mold from the inside of a piece of the vascular system.
That's what the embalmers believe as well, John, that it's actually taking on, like you say, the shape of the main canal and then all the tributaries running off of it. Correct.
Mm-hmm. That's exactly what this is like. I mean, I can't really see anything else that will cause that. And we've got some more examples to look at, Tom, I think. So here's another example here, 6 inches long.
Yeah, and that's not uncommon, John. Many of the embalmers are finding these clots in the 6 to 10 inch range, and there's actually been some cases where they pulled clots that are 2 feet long out of people's legs. So it's an amazing, serious thing that's going on.
So it's 6 inches, 16 centimeters. And again, that one's clearly showing a bifurcation in my mind, isn't it? It's an arterial cast.
Correct.
And if that was in a vessel, I don't see any blood getting through at all. Quite incredible. Now, let's just point out that these just aren't isolated incidents. These are several. There's some more in a jar, similar to yours.
Yeah. And I spoke with embalmer Richard Hirschman recently, and Richard says that he has over 250 photos on his phone, Dr. Campbell, of clots coming out of over 250 different people. He's got examples of this white fibrous clots, as well as another issue we'll talk about called microclotting as well. So he's got photos from lots of people that he's embalmed.
Yeah, so that scalpel there, again, would be about probably 8 inches long altogether. The blade would be a couple inches long. And I think what we're seeing here is we're seeing the blood clot that you would expect.
Right.
And then these white things are just... Yeah.
On the and like I said, embalmers have been seeing those forever. They actually look and feel like grape jelly. They dissolve easily in their hands. Much different than these white fibrous clots, and much different than embalmers have been seeing chicken fat clots for years too. They're small, yellowish in color, and they tear very easily. Very different than these large white fibrous clots that are much tougher and more elastic.
Yeah, the yellow one medically, I think we call that white thrombus. It's the platelet aggregation. It's a well recognised pathological process. Just look at a few more to show these aren't just random things. These are more here. Again, very similar. Another example there. Masses of these things. I mean, what kind of volume? Are we getting like a pound of these out of someone? Or
it's shocking.
500 grams. It's incredible.
Yeah. And there's different doctors and scientists around the world that are looking at the problem and trying to figure out how it's forming. There's a few theories that have come up recently. There was a paper out of Cambridge, right in your neck of the woods, Dr. Campbell, a few months ago, that talked about a process called frame shifting, where the our ribosomes might be misreading the modified RNA that they're receiving and producing about 10% of the time what's called an aberrant or nonsense protein. 90% of the time it's producing the correct spike protein that it's supposed to, but about 10% of the time it's producing a nonsense protein that then could be the formation of these white fibrous clots. So that's
and of course, amyloid is a well-known pathological protein. For example, it accumulates in the brain, doesn't it, in Alzheimer's disease, for example?
Yes, sir. Yes, sir. Another theory that's out there is that the spike protein may be damaging or irritating the endothelial lining of the inside walls of the blood vessels, and if it actually causes the endothelial lining to rupture, because it's a thin single layer of cells, that tissue factor from the interior of the walls of the blood vessels could be spilling into the bloodstream and forming these clots as well. So there are scientists around the world that are looking at the problem of what exactly is forming, or how this amyloid material is building up in the bloodstream.
Mm-hmm. I mean, the idea that it's damage to the vascular endothelial wall, I don't really see that, because these things are solid, aren't they? They're, if that's the lumen of the blood vessel, then this white stuff is like filling up the whole gap in the middle, isn't it?
Yeah, well, we think it's growing, right? So it's at some point it's smaller, right, and blood's still able to flow around. But then at some point it completely blocks off a vessel, or embolism breaks off and goes to a critical juncture, and that's when you get your stroke or heart attack. So it may be a process where it takes maybe 6 months, maybe 12 or 18 months for these to grow to the size that they become dangerous to a living person.
Really? So they could be they could be growing for some months.
Could be. We're not sure, but that the data that I've collected seems to indicate that's a possibility. Because some of the embalmers didn't start seeing the white fibrous clots until the middle of 2021, after a certain event happened earlier that year.
Let's go back a bit. 2020.
Yeah.
There was a lot of people getting the Wuhan version of the SARS coronavirus 2 and then into the alpha. And that's before the vaccine rollout, of course, when this disease was presumably rampant, because there was no vaccination. Were you getting any reports of these white things, whatever we call them, happening in 2020?
I did indeed, John, to a lesser extent. In our first survey, 44 of the embalmers, we got 179 responses from embalmers in our first survey that we did last year. And 44 of those embalmers did see the white fibrous clots. And that makes sense because, like I said, there's a spike protein on the surface of the virus itself. And we believe that spike protein on the virus itself can lead to the formation of these amyloid proteins. But then the embalmers saw that explode in 2021 when we had the advent of the rollout of the medical intervention. So many more embalmers saw the phenomenon in 2021. And as we know, there's a rationale for that, right? Because the medical intervention was supposed to stay in your deltoid muscle and produce just enough of the spike protein to elicit an immune response and do that for just a couple of days of a week, and then its job is done. It's got you ready for COVID when it came. But we know now that that's not what happened at all. The medical intervention goes all over your body, turning your whole body into a spike protein factory, and it can do that for months at a time. So the scientists that I've talked to, John, believe that it's exacerbated or supercharged the effect of the formation of these white fibrous clots.
I just have to take a breath, Tom, to pause so I don't get cross. We were told exactly what you said, and it was wrong. These lipid nanoparticles are systemically distributed. They go everywhere. And we're just starting to learn some of the consequences of that. Misinformation, lie, whatever, propaganda, or whatever you want to call it. But we'll stick with we'll just stick with this. So 2021, 2022. Did the amount that we're seeing remain constant 2021, 2022, 2023?
No, 2021 and 2022, when we did our survey last year. In fact, we can go to the slides if you want to. We actually
we will in a minute. Yeah.
But actually, in 2023, when we just checked this year, the percentage of corpses that contain the white fibrous clots went down from an average of about 30% down to 20%.
It's in 2023.
In 2022, it was about 30% of corpses contain these white fibrous clots, like wow. I'm showing here. Yeah. But in 2023, that went down to 20%. And that's not necessarily a vindication of the medical intervention. Because if you remember, here in America, about 80% of adults over the age of 18 got at least the first two medical interventions way back in 2021. But only about 20% of Americans took the BA4, BA5 bivalent Omicron booster in the fall of 2022. And even less Americans, about 15%, John, took the XBB 1.5 booster that came out last fall of 2023. So as you get further and further away from the medical interventions, you might expect to see less of these white fibrous clots, which is indeed what embalmers said in 2023.
So basically, I think we've identified a temporal correlation and a quantitative temporal correlation there.
Well, we can't necessarily say correlation's not necessarily causation, John.
No.
But I'm seeing an awful lot of correlation here, so I'll just let you know that.
Yeah, we're not short of correlation at the moment, Tom. That is for sure, unfortunately.
But I think, I think the data indicates, though, John, it is a spike protein problem.
Yes.
Regardless of where the spike protein comes from.
Of that, I am completely convinced, Tom. Completely. The embalmers you've talked to, had they seen anything like this? Anything at all like this before
No, the embalmers I've talked to, John, and you'll see in the survey, these embalmers have 20 or 30 years of experience, John,
Yep.
and they've never seen this phenomenon before
Yep.
until the
Yep.
last few years. Like I said, they've only seen grape jelly clots and chicken fat clots in the past, not these white fibrous clots. Yeah.
And I've got half a dozen big, thick books on pathology, and they're not in there. This is a new phenomena. It's a new pathology. Should we go and look at some of your data on the slides, Tom? Is that
Absolutely.
That okay?
Let's go look at some of the data, and then I have a story for you afterwards. It's a bit of a scandal, I think, but we'll talk about it maybe after.
Let me give you a story just before that as well. I've just been talking to a senior undertaker in England, and he wasn't aware of this, but he's actually been talking to his embalmer just today. And this guy basically embalms all the time. It's what he does. And he says in the people he's embalming, he's seeing a fifth to a third of people with these clots.
That's not surprising to me. That's right in the wheelhouse of the averages you'll see here in the slides coming up.
20 to 30%. Now, one thing that surprised me, he says that the amount of embalming prior to cremation and prior to burial is roughly the same. Again, where we live, it's about 30%. In other parts of the country, it's 50 or 60%. Mm-hmm. So basically, he's saying 20 to 30% of people being embalmed and 20 to 30% of those having these clots. But, of course, there's no reason why the people that are being embalmed would not be a representative sample. So from this, it looks like it could well be that 20 to 30% of people that are dying have got these clots.
Correct.
This is just a mind-blowing, massive, new pathology. I mean, I'd heard about these clots, about 18 months back, Tom. But then when I got your email with the information, I'm just blown away. I am blown away. You can see I'm blown away by it. The magnitude of the pathology that we're talking about is immense.
And in addition to the white fibrous clots, as you'll see in the slides coming up, there's been an increase in the traditional grape jelly clots and also this phenomenon of microclotting as well of the blood.
Yes, you did say that. As well as the clots, you're getting this sort of coffee ground thing.
Correct.
And of course, coffee ground is old altered blood, and this is classic of small thrombi, small blood clots.
Correct.
So we've got the two pathologies here. We've got the white ones, and we've got the microclotting as well.
Yeah.
Now this is an impressive study that you've done on your own volition, Tom. Quite impressive. Do you want to just basically talk us through it as we look through?
Yeah, I did the study from December 8th until January 8th, so it just finished about a month ago.
Yeah.
And I used a two-prong approach, John, for the study, survey. I sent it to use a top-down approach by sending it to 50 national, regional, and state funeral director associations, each with hundreds of members under them, funeral directors and embalmers. But I also used a bottom-up approach. I sent the survey directly to over 1,700 funeral homes. I found the addresses for over 1,700 funeral homes around the world and sent the survey to them directly. It was an email with a link to a SurveyMonkey survey. And the survey is really easy to take. This year's survey was 12 questions. Last year's was 7 questions. It only takes about 3 or 4 minutes to take. And when I set up the questions, John, I made sure that I kept the survey as unbiased as possible. Nowhere in the survey questions nor in the survey instructions do I ever mention the words COVID or COVID vaccine. I only asked the embalmers, what are you seeing? When did you see it? And how much are you seeing? What percentage of your corpses contain these clots? So we try to keep it as unbiased as possible. And the first question we ask the embalmers, by the way, that's not shown on the screen here, is where are you from? So in the UK, for example, would be which country in the UK are you in? The United States would be which state are you from? And we did that. We allowed the embalmers to answer this survey anonymously, John, to keep them so they could feel comfortable answering the survey. But we wanted to check for regionality. Unfortunately, I didn't get enough responses to really determine whether there was regionality or not in terms like the bad batch theory, for example. So I didn't have any data there. But
I think we've just established that this is probably about the same prevalence in the United States and the United Kingdom.
Correct. So the second question we asked them this year is how long have you been an embalmer? As you can see, quite a few embalmers have at least 20 years of experience. And this is
highly experienced individuals. Yeah.
So they know what the blood looked like in the years prior to COVID. They know what it looked like in the year of COVID, but no vaccines. And then they know what it looks like in the years of both COVID and the vaccines. Yeah. Well, that's a good thing.
Yeah, we're dealing with experienced people.
So the next question we asked him, is how many corpses a year do you embalm? As you can see, the average there is about 100 if you average the bars together. So they see bodies on a regular basis. Some of the embalmers, like Mr. Richard Hirschman, who's a trade embalmer in Alabama, who's in the Died Suddenly movie, Richard does over 300 corpses a year because he actually embalms at 12 different funeral homes. So he does he'll do 2 or 3 bodies a day sometimes. But the average is 100 corpses a year. So these people, they know what they're seeing.
Yeah. Again, it's not a rare event. It's a common thing, isn't it, that's happening?
Correct. We asked them again this year. Did you observe the white fibrous clots again this year in 2023? We wanted to see how that compared to 2022. As you can see there, John, 197 out of the 269 embalmers that responded to the survey are indeed seeing the white fibrous clots still in the end of year 2023. So that's not a good sign. So then the next natural question we asked him, John, after that is, well, then what percentage of your corpses are you seeing these white fibrous clots? And as I said earlier, it's down a little bit from our survey last year in 2022, and that's a good thing. We're down from 30% to 20%, and that includes, by the way, if you average all the bars together, including the green bar with the 63 embalmers that said none, if you include that as well, you get about an average of 20% of the corpses that the embalmer saw these white fibrous clots in. But
it's just incredible. This is looking like this could be the cause of 1 in 5 deaths.
Well, look over there on the left. You can see 48 of the embalmers saw them between 21 to 40% of their corpses. Another 29 embalmers saw these white fibrous clots between 41 to 60% of their corpses. 11 embalmers saw them between 61 to 80% of their corpses. And then we have 6 embalmers that said they saw them between 81 to 100% of their corpses. So it's telling me, John, this is not a rare phenomenon. These things are prevalent. So it's quite, and as we said earlier, they never saw these clots prior to 2020.
Yeah, incredible.
Shocking. We also asked the embalmers about microclotting, and they don't describe it as microclotting. As you said, they call it what looks like coffee grounds.
That's exactly what it looks like, yeah.
As the blood's draining off the corpse and they're trying to get the formaldehyde in, they'll see what looks like coffee grounds in the blood. They also call it dirty blood. Yeah. And we asked the embalmers, did you see that in 2023? And look at the results there, John. 212 of the 269 embalmers, 79%, are seeing this phenomenon in 2023.
Now, this phenomena of coffee grounds, they might have seen this occasionally in people who had blood clotting disorders prior to 2020.
Correct. If you go to the next slide,
but very rarely.
Yeah. That note there, they would see it very rare. One of the embalmers, I think, told me that he would see it particularly in patients that had heavy chemotherapy. He'd see coffee grounds or dirty blood in them. But as you can see there, the average of all those bars is 25% of corpses in 2023 containing these, the microclotting, the coffee grounds or dirty blood. So that's at least a 5 times, a quintupling of that phenomenon since the years prior to COVID. So, and again, look over there to the left, 58 of the embalmers saw it between 21 to 40% of their corpses. 32 of the embalmers saw the microclotting between 41 to 60% of their corpses. 16 embalmers between 61 to 80% of their corpses. So this is an alarming thing. And as we talked about earlier, this could be just as dangerous as these large white fibrous clots.
Certainly.
Yeah, because the microclotting occurs at the capillary level, and it can block the exchange of oxygen at the lungs, and then the carrying of that oxygen to all the major organs of the body, including the brain, and like your eyes. You have small capillaries in your eyes. So this is just as dangerous a phenomenon as the white fibrous clots.
Well, we've got blood vessels going. The only part of the body without blood vessels is the very front clear part of the eye. Everywhere else has got a vascular blood supply. It's otherwise it'd go black and drop off.
We asked the embalmers last year's survey. We asked them about the grape jelly clots, so we asked that question to them again this year. And as you can see, 40% the embalmers on average are seeing the grape jelly clots in about 40% of their corpses in 2023. And they've not only seen more, they've increased in viscosity. They're more like grape jam now than grape jelly. So the next question, we compared that to what they saw in the years prior to the pandemic.
Yeah.
And if you go to that slide, you'll see that they saw them in 30%. So it was still a high number, but there's still an increase from 30% up to 40% now in 2023. So that can be alarming as well.
So we're getting 5 times more microthrombi, the little coffee grounds.
Mm-hmm.
We're getting 30% of the bigger clots.
30 up to 40% now, yeah.
Yeah, and we're getting 100% more of the white ones. So all of these intravascular pathologies are massively increased.
Correct.
Wow, 30%. Right.
Yeah. One of the other things that embalmers mentioned to me throughout the year that we went ahead and asked a question on this year is about infant deaths. And, this is a very sad area. I guess the good news, John, is that you see the longer bars, the no bar, 184 embalmers, 69%. Said they were not seeing that. Another 25 embalmers couldn't answer the question because they were younger embalmers and weren't embalming prior to 2019. But only 20% of the embalmers said they saw an increase in 2023 in infant deaths when compared to the years prior to the pandemic. So, but that can still be alarming in and of itself. And there's actually a little bit of an explanation for that. I've been told by some of the embalmers that there seems to be a lot more cremations these days of infants. So if there is a problem with the infant, obviously that evidence is being destroyed. Yeah. And a lot of the embalmers have also told me that hospitals these days seem to be more prone to asking the parents if they want to let the hospital handle the disposal of the remains of the child. Yeah. So I think some of the embalmers are seeing less infants these days because of those two reasons. Mm-hmm. But if you go to the next slide, we asked
infant being let up to 1 year old. Are you classifying that as, Tom?
Yeah, because we included stillborns in there and SIDS as well. Because there's been cases of SIDS where
sudden infant death syndrome.
Right in the crib, have passed away, unfortunately. And we know, John, that the spike protein from the medical intervention has been found in the breast milk of women going to the child. It's also being found, I believe, in the delivered placentas. After the woman delivers the child, they found the spike protein in that as well. So this is really unfortunate if the spike protein is getting through from the mother to the infant. It's quite an unfortunate situation. The next slide tells you of the 20% who did see an increase in infant deaths in 2023 compared to the pre-COVID years. They saw an increase of about 25%. So excluding that blue bar, if you don't average that one in, if you start with just the yellow bar down and average those together, you get a 25% increase in infant deaths for just those that saw the increase. So not a good thing.
Not good at all.
Yeah. Our last question on this year's survey, John, dealt with age stratification. We did not get a chance to ask the embalmers last year about that. And I wasn't too surprised at the results here. You would expect probably to see, we asked them, did you see an increase in the clots in 2023 of all types, grape jelly, white fibrous clots, the microclotting, in any particular age group? And we asked them to mark all age groups that applied, so they could mark multiple answers on this one. And as you can see, the longest bar there is in the 66 to 80-year-old age group. Not too surprised at that, because as people get to that age, they start to have problems, with cholesterol, plaque buildup in their systems. But I am a little bit disturbed, John, by that 36 to 50-year-old bar. That's a pretty long bar there. 89 of the embalmers saw an increase in the clotting and
clots.
And this is the age group you don't normally associate these people with having heart attacks and strokes. Usually that starts happening when you're in your late 50s, early 60s.
Correct.
But now, and this, information, this data actually dovetails very nicely or very closely to what Edward Dowd's been finding in the insurance industry. He's been taking a look at both USA and UK death and disability data, and he's found a tremendous increase over the last 3 years in that particular age group of 36 to 50-year-olds. So the data that the embalmers are supplying to me dovetails very closely to the insurance death and disability data from Edward Dowd.
And we also know there's been an increase in excess deaths, certainly in the UK, nationally, in that age group as well.
Same here in the United States. We've had, at least 10% excess mortality over the last 3 years in the United States. And in most countries, Western countries around the world. Surprisingly, we haven't seen much excess mortality at all in African countries that had very little uptake on the medical intervention.
Yes. It's a lot of extra people are dying, and you've just identified yet another correlation, Tom. We're getting a lot of correlations, as you say. Now, this is from embalmers. In the UK, I think we're doing less post-mortems now. Is that the same situation in the States?
It is, unfortunately. There seems to be a lot less autopsies done.
Yes.
And it's surprising, isn't it? Because if you were the parent of a 20 or 30-year-old that was in great shape and then they died suddenly, wouldn't you want an autopsy performed on your
absolutely
your child? Yeah, I would too.
Otherwise, you're going to spend the rest of your life wondering what the heck.
Yes, but I believe unless there's foul play suspected, or maybe like overdose on drugs, where they do toxicology, then coroners and medical examiners will not take close looks at the vascular system. They may look closely at the heart, but not at the rest of the vascular system. So the embalmers I'm talking to believe that a lot of the medical examiners are missing these clots, and the embalmers are the ones finding them, John.
I think that's true, because the embalmers are looking at all of the circulatory system because they're flushing it out. Whereas in the autopsy situation, you might just be taking a slice, of, for example, a coronary artery. I mean, the post-mortems I've been to, they don't slice open the arteries and look at the inside. That's not a common
and I
thing
think
to
most
do.
Death certificates are just saying thrombosis or embolism or something like that. They don't describe, I believe, the type of clot, whether it was a grape jelly or a white fibrous clot or microclotting that they saw. They just generally label it as thrombosis. So unfortunately, I don't think we're getting good, stratified data in terms of off the death certificates from coroner reports on exactly what types of clots they're pulling out of people or seeing.
Even so, I'm still surprised that pathologists aren't bouncing up and down about this, saying, just a minute, there's a new disease here. Because if you discover a new disease, you can call it Campbell disease, Haviland disease. You'd think that if they've discovered something new, they'd be absolutely chomping at the bit to write a paper about it.
Well, it's hard to find something if you don't go looking for it, John.
Yeah.
And like I said earlier, I wouldn't call it necessarily a scandal, but that's the first word that kind of comes to my mind.
Yep.
When I first did this survey and sent out to the world, the 50 funeral director associations and the 1,700 funeral homes around the world, I started the survey on the 8th of December for this most current survey. And after about 5 days, John, I only had about 14 responses in my SurveyMonkey collector. I said, this is terrible. What's going on here? I should have a lot more responses than this. Yeah. So I had a list of the 30 U.S. state funeral director associations that I had sent the survey to. I picked the top 30 U.S. states by population.
Yep.
And I called each one of them, their telephone, and I talked to either their president or a secretary or somebody else in their office. Yep. I said, hey, could you please forward that survey, the email I sent you last week with the link to our survey down to your embalmers?
Yep.
And, well, God bless the Pennsylvania Funeral Directors Association, John.
They did
exactly as I asked. Yeah. Because I got up the next morning and I saw 93 responses from embalmers in my SurveyMonkey collectors, and they were all from one state, Pennsylvania. I then got up the next day and I saw 32 more responses from embalmers, and they were all from Pennsylvania again. So in 2 days, I got 125 responses from embalmers in just a single U.S. state. And it told me two things, John. It told me, first of all, that embalmers, they want to tell you what they're seeing in the embalmer room if they feel like they have the permission from their funeral director boss or from their state funeral director association.
Yep.
But it also told me something else. Remember, there was 29 other funeral director associations here in the United States that I sent that email to. So they must not have sent it down to their embalmers. They must have suppressed it, deleted my email, and not forwarded it to their embalmers to take. So it's telling me that there's a terrific suppression going on at either the funeral director association level or the funeral director himself, not pushing the survey down to their embalmers to take.
But the data you have collected is somewhat representative of the world, really, because we've got data from the UK, which is consistent, some data from Australia, a little bit from New Zealand, a little bit from Canada, and the little bit that is getting through is essentially consistent, is it, Tom, with the numbers?
It is. I've got very poor responses, though, frankly, out of the UK and Australia and New Zealand. It seems to me that the fear factor is even worse there in your areas of the world than it is in the United States or Canada. Because the bulk of the responses did come from the United States and Canada. But and I have two theories why that might be, John. If you're a lot of these funeral director association presidents are funeral directors themselves. You know, they elect one of their own to be the head of their state association. Or, would you want to participate in a survey if you think that there might be a link between the medical intervention and the formation of these white fibrous clots, you know, or the microclotting and all these issues that have been popping up the last 3 years? So especially if you mandated that all the employees of your funeral home take the medical intervention, you know, you might be setting yourself up for a lawsuit. So, and the other reason I think is, as I said earlier, 80% of Americans here took at least the first 2 medical interventions. So there might be a little personal cognitive dissonance going on where they may not want to know the answer themselves to the question. So, yeah. One of the other proof I have, by the way, in your country is when I sent the survey to like 6 national, regional, and funeral director associations in the UK. London has their own. There's a British Institute of Embalmers. There's also a UK National Association of Funeral Directors. Well, the UK National Association of Funeral Directors, John, sent me back an email saying that they were going to decline participating in the survey. They said, we'll let the British Institute of Embalmers answer for us. Well, I already sent an email to them asking them to participate in the survey. What would be the harm in the UK, National Association of Funeral Directors forwarding my survey down to their hundreds of funeral director and embalmer members, encourage them to take the survey? Because like I said, the survey itself was non-controversial. It only asked the embalmers, what did you see, when did you see it, and how much did you see? Yeah, but yet there's this tremendous reluctance to take the survey.
The other thing that's in my mind is if these things are developing, especially over a period of time, they've got to be causing symptoms, and you would think that the radiologists and the surgeons and all the doctors doing the investigations would be seeing these things as well and saying, "Hoi, just a minute, there's a new disease process here," but it just doesn't seem to be happening.
Well, people are coming in to the doctors with conditions, but I think sometimes they're being misdiagnosed, or the doctor is steering them away from what the real diagnosis might be. And I think one of the reasons there is, as we know, the medical system, to a certain extent, John, unfortunately, is captured. They've had carrots and sticks along the way, right? For example, here in the United States, we have Anthem, Blue Cross Blue Shield health coverage, and they, for every doctor that can get at least 75% of his patients to take the medical intervention, they get paid $250 per injection. So if you had 100 patients, that would be $25,000 extra dollars in your pocket to get.
Thank you very much. $25,000.
And then, of course, on the opposite end, they have sticks as well. If these doctors, if they stand up and say anything negative about the medical intervention, then they can have their licenses pulled, their board certifications taken away from them. So it's an unfortunate thing of carrots and sticks. And by the way, we're seeing the same thing happening at our regulatory agencies as well. Both last year, when I completed the survey last year, I sent the USA portion of the results last January to the FDA. They had a meeting of their vaccine and related biological products advisory committee on the 26th of January of last year, 2023. I actually asked to speak at that meeting. They had an hour set aside for oral presentations, but there was 20 speakers allowed, and there was a lottery ensued, and I didn't get a chance to speak. But I did submit my information in a written format last year, John, and I got a tracking number from the FDA, but throughout the entire year of all last year, I never heard once from the FDA nor the CDC. So, I'm not holding my breath, but as soon as I had the results for this survey done on the 8th of January, the very next day on the 9th of January, I packed up all my results, including the presentation that I just showed you, and also all the SurveyMonkey data that I had, all the files I used to collect the data, sent that off to the FDA, CDC, and NIH again this year, and hopes that they will do something. Because, I, as a retired Air Force major, I shouldn't have to do this, right? This is their job to do. They should be investigating this and seeing if there's any possible link between the medical intervention and this unusual clotting that we've been seeing going on for the last 3 years. So I think it's just a shame that they haven't done it.
And of course, you to some extent, despite the difficulties you've identified, are able to say how many white clots there are. But of course, you can't put the other variable on that with the amount of vaccines and the time since vaccines. But they can. They can do that. They have that data.
Correct. They won't share it with anybody publicly.
Just quite incredible. I mean, this is a completely new pathology. Yeah. It's only been identified by people like yourself, by talking to embalmers. It's just absolutely staggering that this would be happening.
Now there are a few, like I said earlier, some of the embalmers are actually funeral directors themselves. They're a funeral director and they do their own embalming. Well, one of the ones that's in the Died Suddenly movie, she is in that role, so she gets a chance to communicate with the families of the deceased. And she says that every time she finds the white fibrous clots, she'll go and ask the family of the deceased, did your loved one get the medical intervention? And she says 100% of the time, John, without fail, the answer is yes. So I know that's just anecdotal, one person, but it is kind of a stunning thing to discover. So
that anecdotal report is an operational hypothesis that should be tested, because the FDA and the CDC and the regulatory agencies in my country, they have this data, and not only are they not analysing it themselves, they won't let anyone else analyse it for them.
I totally agree. And here's the problem, John. If the mRNA technology with the lipid nanoparticle delivery system is responsible, and I'm not saying if, I'm not sure, like I said, correlation is not necessarily causation, but if it is responsible for all this unusual blood clotting we're seeing, as well as things like turbo cancers, miscarriages,
heart failure,
neural damage, myocarditis, all these things, if it is, we've got a problem, because Big Pharma is getting ready to unleash a whole bunch of mRNA-based shots next year. They want to do the flu shot, the RSV shot, the shingles shot. Moderna has about 40 of these mRNA-based shots in the pipeline over the next few years to push out on the world. So I am actually calling for a moratorium. I think that we need to do more of an investigation to check and make sure that these medical interventions, that this technology is indeed safe before we decide that we're going to pump it into, not just hundreds of millions, but even billions of people around the planet.
I too call for a moratorium, because we've got enough data now to raise significant questions that absolutely must be answered. In my country, I think it's Harwell Science Park in Oxford, a new plant to build generate 250 million doses of Moderna mRNA.
And people
a year.
They may ask, okay, we talked about 10% excess mortality earlier on, and people say, well, I'm not seeing that 10% excess mortality. Well, it's actually subtle at the individual level. Here in America, we're a country of 300 million people, and about 3 million of us died every year before the pandemic. Yeah. Well, if we've had about 10% excess mortality the last 3 years. Yep. So 10% of 3 million people dying is an extra 300,000 people dying per year. That's 300,000 extra people dying a year. But excess mortality to the individual means instead of you seeing 10 people dying this year, you see 11 people die this year. That's 10% excess mortality, right? 11 versus 10. Are you really going to notice 11 people dying this year versus 10 dying last year? Probably not, right? So that's why it's so subtle at the individual level. But when you aggregate it up to large populations, it becomes staggering numbers, like 300,000 extra Americans dying every year. That's what's going on.
The other thing that I get, thousands of messages, literally thousands, people dying at times when you wouldn't expect them to die. Young people dying, middle-aged and older people who are perfectly fit, no pathology at all. And
Mr. Richard Hirschman talked to me. Yeah, Richard Hirschman talked to me the other day on the phone, and unfortunately, he had to embalm a young, out of the respect for the family, I won't say the exact age, but it was a girl in her teenage years, and she was riddled with the clots, John. And then he had a 31-year-old, I think, a few days after that. So it's heartbreaking, and you can understand what the embalmers are going through. There's a lot of psychological damage going on here because they're seeing this horrific phenomenon happening, and a lot of them feel like they cannot speak out. They don't want to damage the reputation of their funeral homes. They don't want to put their own careers in danger. They see, like I said, doctors getting their licenses pulled and their certifications taken away, so they don't want to rock the boat. But yet there's something horrific going on.
It's absolutely cast iron evidence. These photographs that we've shown, it is incontrovertible. The evidence is there, and yet it's being ignored. That's what convinced me. I mean, I've heard about this, and I saw these photos you put together, Tom. I thought, just a minute. This is absolutely 100% physical, 100% real. These came out of dead people's circulatory systems, and I believe it's what killed them.
Well, I wasn't sure when I started the survey. I watched that Died Suddenly movie, and 6 or 7 embalmers in that movie said they were seeing these clots, and I thought it might have been a bunch of kooks. So I did the survey not knowing what kind of results I was going to get. But when I got the results of my first survey, and I saw, my goodness, 70% of the embalmers are seeing this phenomenon, and they're seeing it in like 30% of their corpses, now 20% of their corpses. It was mind-blowing to me. It was just spectacular in an awful way.
Quite incredible. What I'd like to do, Tom, I'll do a quick video where we just show some of those photos, if that's all right. Then play this whole thing if people want more detail. And well, thank you for what you've done. It's just a really impressive piece of citizen science, but by someone with the mathematical and statistical data analytical skills to do it in such a convincing way.
Well, my hope is that I don't have to do it next year. I'm hoping that the FDA and CDC will get off their rear ends and do it themselves and give us some good data, because they really should be doing that. They're the professionals, not me. I just took it upon myself. I retired. I had the time to do it, and I was glad to. And I was curious too, John. I wanted to know the answer to the question. I've got family members who've taken the medical intervention, and I want to know if they're in danger.
And we simply don't know the time scale. We've got some small intimation that the numbers have gone down in 2023 when there was less boosters, but we simply don't know. Are these things forming over days, weeks, months, years?
Yeah. More research needs to be done. Like I said, the embalmers are speculating maybe 6 to 12 months in order for these things to grow large enough to stroke you out or give you a heart attack. But that's based upon the data we've collected, and that's not for sure yet.
So, I mean, that means if we've had a booster campaign in autumn in the UK, we can look forward to more of these things throughout 2024.
Well, the data would seem to indicate that, John, unfortunately.
We hope not, but I'm pleased that people like you are keeping a close eye on it, Tom, and keep us informed. Well, what's your next step?
Just continue to go. Thank you so much for giving me the platform to. And I'm hoping that people like Russell Brand, who I know follows you, and people like Joe Rogan, maybe even Tucker Carlson, will see our interview together and get on their platforms as well.
Tucker, get Tom on. This matters. Mainstream media is not going to do this.
Yeah.
We need to get this out there. This is people's lives. This is. People sometimes tell me off, Tom, for being a bit frivolous about things, but I'm not. This is. I couldn't feel stronger about this.
And this is a phenomenon. It's a little bit different than myocarditis or tinnitus or the other, because you can see the evidence right here. It exists, and when people see it, a picture is worth 1,000 words.
Yep. And is that in your hand there from one person? Do we know, Tom?
Yes, that was taken out of one corpse by Richard Hirschman. Correct.
Major, thank you.
My pleasure, John.
And let's talk again soon.
Will do.
Thank you.